Hello everyone, welcome back. Today I'll be covering traumatic thoracolumbar spine injuries. The topics that I will cover include spine stability definition, Denis 3 column, normal lumbosacral X-ray, the burst fracture, either stable burst fracture or unstable burst fracture definition, the chance fracture, and lastly regarding TLICS classification or TLICS score. Spine stability defined as the ability of the spine to prevent development of neurological injury and progressive deformity in response to physiological loading and a normal range of movement. Spine stability relies on the integrity of both the bone and the ligamentous component. Injury to either or both can result in spine instability that requires surgical stabilization. Regarding Denis 3 column theory, we started off at the anterior column. It includes anterior longitudinal ligament and anterior two-thirds of the vertebral body, including the annulus. That is the anterior column. The middle column consists of posterior longitudinal ligament and posterior one-third of vertebral body and the annulus. For the posterior column, include all the posterior structure, that is the pedicle, the ligamentum flavum, the facet joint, the spinous process, and don't forget the lamina. Denis specified that injury to the middle column renders the spine mechanically unstable. Instability defined by injury to the middle column, evidenced by widening of interpedicular distance on AP radiograph, loss of height of posterior cortex of the vertebral body, disruption of the posterior ligament complex combined with anterior and middle column involvement. Regarding a normal lumbosacral X-ray, this X-ray illustrates the normal X-ray. On the left hand side, the AP view, and the right hand side is the lateral view. The AP view, you can see demarcated, the green is pedicle. The green illustration is the pedicle. Then the transverse process is the purple. Then in the middle is the spinous process. From the lateral view, you can see the pink one, I illustrate the vertebral body. The blue is the intervertebral disc. And another pink one is the facet, superior and inferior facet, or number 3. For another view, this AP view shows a pedicle and there's an increase in the interpedicular distance. You can see is by the arrow that is illustrated on the left hand side. On the lateral view of the lumbosacral region, there is a loss of vertebral body height, there's a middle column involvement, and there's a disruption of the anterior alignment. So this patient has a burst fracture of L1. Stable burst fracture, the mechanism of injury is due to axial loading force, compression force. The stable is defined as whereby A, anterior and middle columns are disrupted but the posterior column is not affected. B, the kyphosis angle is less than 30 degree. C, loss of vertebral height more than 50%. D, patient is neurologically intact. This picture illustrates the lumbar vertebra. There's a reduce in the vertebral body height. The black arrow shows the compression force and it causes the fracture anteriorly and involving the medial column, and if so severe the pieces will be displaced sideways. Regarding unstable burst fracture, defined as a 3-column injury involvement. B, the kyphosis angle is more than 30 degree. C, there is decrease in the vertebral body height. And D, usually patient has a neurological deficit. This lateral lumbosacral view shows a burst fracture of L4. We can see there is a reduce in the vertebral body height. There is an involvement of the middle column and there is a posterior bone displacement seen encroaching into the spinal canal, and the kyphosis angle is more than 30 degree. Regarding chance fracture, is usually due to seatbelt injury and common at L2, L3 region, is a flexion distraction injury. This first AP radiograph of the lumbosacral X-ray shows a chance fracture. You can see initially the pink one is the vertebral body height, and then after that sometimes you can see there's an increase in the interspinous process distance as marked as by the arrow. The second lateral view of the lumbosacral X-ray shows a chance fracture whereby the fracture is bony chance, okay? Fracture through and the anterior, middle column and the posterior column is separated through and through. Regarding thoracolumbar injury classification and severity scale, TLICS Score. The TLICS consists of 3 independent parameters. 1. Injury morphology. 2. Integrity of the posterior ligamentous complex. D. Any associated neurological status. This figure illustrates the TLICS 3 independent predictors. Again, number 1, the morphology. Number 2, the integrity of the posterior ligamental complex, PLC. 3, neurological status. For the morphology, whether it's a compression fracture, get 1 mark or 1 point. Burst fracture, 2 points. Translation or rotation is 3 points. And if there is a distraction injury, is 4 points. This can be concluded by using a radiograph or a CT scan. For integrity of the PLC, whether it is intact is 0, suspected is 2, injured is 3. This one can be confirmed by using an MRI. Number 3, the neurological status, whether intact is 0, whether there is a nerve root involvement is 2. Number 3, another one is complete cord injury is 2 point. Incomplete cord injury is 3 point. And if patient present with cauda equina is 3 point. This is all by physical examination. This score predicts the need for surgery. If 0 to 3 point, usually we non-surgically by using a brace. 4, it depends on the surgeon's preference. More than 4, usually surgical intervention is indicated. Yay, we have finished to the end of this video. I hope you have learned something. See you in the next one. Take care and bye.